Hi, my name is Noah Drew, and I'm speaking to you today from the University of North Texas Health Science Center at Fort Worth. This is the first of a two-part series we are producing called Meet Us at the Met. This community education event is a virtual rendition of an in-person series by the same name. We're not just trying to be trendy. MET actually refers to our medical education and training building where we usually meet. Today's featured guest is Dr. Erika Thompson. She's an assistant professor in the School of Public Health where she teaches maternal and child health epidemiology. She is also the program director for the Maternal and Child Health MPH program. Dr. Thompson received her bachelor's in health science and MPH in epidemiology from the University of Florida. At the University of South Florida, she received her PhD in public health and 2 graduate certificates in biostatistics and maternal and child health epidemiology. Prior to joining UNT Health Science Center, she completed a 2-year postdoctoral fellowship focused on women's reproductive health at the University of South Florida. Dr. Thompson was recently recognized as a leader in her field, being honored with the prestigious Judy K. Black Early Career Research Award from the American Academy of Health Behavior. I hope you're looking forward to her talk as much as I am.
Hi, my name is Erica Thompson. What do you typically think about when we talk about people experiencing homelessness? Is it an adult on the street with a sign? A man under a bridge? Well, while this is a group that's typically visible in our communities, there's a hidden homeless population, and this includes families with children. Why might families with children be a hidden homeless population? Well, they may fear getting turned into child protective services. They may not want to go to shelters, or a number of other reasons. Despite the reduced visibility of this population, they are very much present in our communities. In Tarrant and Parker counties, on a single night in January in 2019, 230 children experienced homelessness, meaning they were either in a shelter or on the street. While 230 is a lot of children in shelters or on the street, our school systems use a broader definition of homelessness. Schools count children who are in a shelter and unsheltered as homeless, but they also count children who are doubled up, meaning they're in someone else's home, like family or friends. And schools also count children living in motels or hotels. In the 2017-2018 school year, 8,362 children were experiencing homelessness in Tarrant County. And remember, that is only school-aged children. That makes up about half of all children experiencing homelessness in our communities. Children and families may face different paths and obstacles compared to single adult males when navigating homelessness. This is in part due to our shelter systems being at first designed primarily for the single adult population rather than for families. So in partnership with the Center for Transforming Lives and funded by the United Way of Tarrant County's Systems Change Grant Program, we set out to explore the journeys of families experiencing homelessness in Tarrant County. We wanted to know what their lived experiences were as they navigated the system for seeking shelter and for housing. We interviewed 24 heads of households, primarily parents of families who are currently experiencing homelessness in Tarrant County. These families came from shelters, rapid rehousing programs, and other homeless organizations. The families were asked to describe their journeys from their last permanent residence to today, and we had them map out their journey over that time period. They mapped where they had been, who they were with, and what they came across at each point in time. What we found out was astonishing. On average, it had been 17 months since the family's last permanent place to stay. And on average, families moved 4 times. These locations included places like cars, emergency shelters, domestic violence shelters, motels, doubled up with friends or family, and rapid rehousing programs. The families we talked to had between 1 and 5 children, and most of these kiddos were younger. So imagine these families all together in these different types of locations, like cars or other people's homes. As the families described their journeys, we asked about what was easy about seeking shelter, but also what made it more difficult for them as a family. What became abundantly clear is that there are three interrelated factors for securing housing stability for families. These factors include transportation, employment, and childcare. As an example, families needed transportation to get to jobs and get their children to childcare. Unfortunately, often new jobs that they were hired for were outside the area where public transportation traveled to from the city center. Also, childcare venues that accepted subsidies were sometimes further away from where families were at. Additionally, without stable childcare, parents were unable to stay employed due to having younger children that needed supervision. I think this quote of one mother captures it perfectly. "I have been trying to get them on CCMS, which is childcare, but I don't know the steps to go through to start them in there. I'm still working on that, and once I get them on CCMS, then I can work on getting a job, because then I'll have a permanent thing for them to go to, and they would be in childcare while I'm at work." Often, parents rely on schools for childcare of school-aged children, but this becomes harder during breaks and summer months. The complexity of getting all of these factors in place at once is daunting for a family as they're experiencing extreme instability. An additional obstacle for families is that shelters may have maximum capacity for family size, which means families may need to separate in order to seek services. And this was a major fear for some of our families. Families were also concerned about the safety of their children as they transitioned through these different locations. Again, think some of these families were in cars or motels. We also asked families, as they navigated their journey, how they found resources. Most people shared that they relied on informal networks such as family, friends, and other people experiencing homelessness. They also did a lot of online searching, and many of the people expressed that a centralized list that described the eligibility for services and current availability of services and resources would be extremely helpful. This would limit the amount of time people spent calling around to different agencies to learn about availabilities of resources. One of the moms in our project captured it perfectly. You have to go on and call all those people, and then it's like ring around the rosy from there. You go around in circles. I'm full over here. I got resources, but I'm full over here. I got resources over here, but try calling there. One factor that parents wish there was more of during this journey are specific activities for children. Parents want to provide as much normalcy for children as possible during these difficult journeys. As one mom in our project reflected, "I believe kids need a safe place, an escape, just for a little while. Because especially for kids who understand what's going on, it's got to be tough." And I completely agree that these are tough journeys for families. This study has been shared with the Center for Transforming Lives and supports ongoing efforts from Tarrant County's Homeless Coalition's Family Homelessness Committee. The committee brings together advocates, housing providers, shelters, educators, and other stakeholders in developing interdisciplinary solutions to help families experiencing homelessness. Now, building on this work, we've sought to explore the reproductive health needs of women experiencing homelessness. We've seen a 3% increase in the number of women experiencing homelessness over the past few years, with and without children. One of the key drivers of my work is that every woman has the control over when and if she has a child, and access and use of contraception is essential for that goal. So with funding from the HSC's U54 Star Leadership Program and the National Institute of Minority Health and Health Disparities, we're in the middle of conducting a research study with women experiencing homelessness. Our goal is to take a systems perspective to explore the barriers and facilitators to contraceptive use among women experiencing homelessness in our community. This project has two parts. First, we've been conducting interviews with women experiencing homelessness to learn from them what they want and how they access contraception. Recognizing women's perspectives is essential for respecting their reproductive autonomy. So far, we've conducted over a dozen interviews with these women. And in the next phase of this project, we'll be speaking with social service and healthcare providers to learn more about the systems supporting these women. As we continue this project, we hope to continue to learn about what women want and need, and how the system either supports or hinders that goal. Our hope is that these findings can inform future interventions supporting the reproductive health needs of this vulnerable population. Overall, these projects highlight the hidden subpopulations of persons experiencing homelessness right here in our community. As we consider maternal and child health issues, we need to recognize the importance of social determinants of health that may compound or exacerbate these health disparities. For families and women experiencing homelessness, access to housing, poverty, and other key social determinants are critical for their health now and through their life course. Thank you.
Thank you for joining us. I hope you enjoyed hearing from our expert faculty members as they shared about their work. I assure you that the examples shared today are representative of the work being done across all 6 of our schools. I encourage you to sign up for future events at the URL below if you're interested in learning more about our institution and how we're creating solutions for a healthier community.